You must do these 4 exercises if you want to avoid long-term ankle problems. Hello and welcome to the Physio channel. In this video we're going to go through the 4 most important exercises that you need to do to recover from an ankle inversion injury. The video is for education purposes and should not replace professional advice. However, we hope it helps, so please let us know in the comments how you get on. So the first thing we're going to do is check ankle flexibility, and the most important movement is this one, bringing your toes up towards your knee. This is called dorsiflexion. This dorsiflexion movement helps your knee go over your toes, which is important for walking normally and especially up hills or at speed. You can restore your dorsiflexion by doing this ankle stretching routine. To do this stretching routine, kneel down in a lunge position and place your foot flat on the floor. Then bring your knee over your toes whilst keeping your foot flat and your heel on the floor. Go as far as you can, come back, and then start to change the angle. So you come in over the big toe as far as possible and back, and then out towards the little toe as far as possible and back. This technique can be enhanced using a mobility band. Perform these mobilizations for 10 to 30 seconds, slowly, under control, and stop if you feel any pain. After performing this technique, if you found walking up hills and slopes more comfortable, give us a thumbs up to let us know. Our next focus is ankle strength. Now, if you don't have an exercise band to use, you could use an extra long sock, a belt, or a strap. To help strengthen your ankle, perform these 4 exercises showing on the screen here. Perform these every day for 3 sets of 15 repetitions. Your balance is also affected by your injury. So do some simple balance exercises 2 to 3 times per day to help correct your balance. Here is a demonstration of some simple balance exercises that you can do. 1 leg balance, adding a ball in to challenge your balance further. You could try heel to toe walking. Imagine that you're walking along a tightrope. You could use a wobble cushion or a balance board as shown here. And finally, we need to make sure your walking returns back to normal and you're not left with a limp. Your normal walking pattern should have 3 distinct phases. Heel strike, where you first make contact with the ground. And then weight transfer, where your foot goes flat and your body weight is transferred over the foot. And finally, the push off. So after the weight transfer, as you get ready to take the next step, you typically push off the ball of your foot using the strong calf muscles on the back of your lower leg. This is the push-off phase. Now, it typically takes about 6 weeks to rehabilitate a sprained ankle, but if you have any problems along the way, make sure you get some one-to-one professional advice. Here on the screen are some other helpful videos relating to ankle injuries. We'll see you in the next video.